Welcome to EyeCan, a podcast about ophthalmology through a uniquely Canadian lens with Dr. Setareh Ziai and myself, Dr. Guillermo Rocha.
The EyeCan podcast has been made possible by support from MD Financial Management and Scotiabank, proud financial partners of the Canadian Ophthalmological Society and Canada's ophthalmologists.
We'll share our experiences as ophthalmologists today and tackle some of the challenges we face as healthcare providers. Are you ready, Setareh?
Let's do it, Guillermo.
Let's do it, Setareh. On this episode of EyeCan, we talk with Dr. Nupura Bakshi about her recently new role as chair of the Canadian Ophthalmological Society's Equity, Diversity, and Inclusion Working Group. Dr. Nupura Bakshi is a retina and uveitis specialist in Toronto. She's also an assistant professor in the Department of Ophthalmology and Vision Sciences at the University of Toronto, staff clinician at the Unity Health Toronto, Mount Sinai Hospital, and Kensington Eye Institute. She has diverse interests, with special interests in medical and surgical education and advancing equity, diversity, and inclusion, or EDI, in medicine. In addition to serving as the director of the EDI for the Department of Ophthalmology and Vision Sciences at the University of Toronto, she is so busy also as the new chair of the COS's new Equity, Diversity, and Inclusion Working Group. It is great to have you here, Nupura. And I think to get things started is I've always thought, as an immigrant myself, I've always thought that Canada is such a diverse country. So tell us about why is it necessary to have an equity, diversity, and inclusion working group at the COS? What is happening now in the current status?
Thank you, Guillermo. That's a great question to start with. And there's no doubt that Canada is always known to be a diverse country, and there's certainly pockets, I think, of very high diversity within Canada as well. But the reason that the EDI Working Group, I think, is really critical, not just for the COS, but for many aspects of medicine, is that we lack diversity as we go higher up within positions of privilege and power. So, there may be diversity in other professions. There is some level of diversity within medicine, but when you go into different specialties in medicine, and even as you advance within medical careers, the diversity does decline. And we have to look at diversity of all kinds. We're not just talking about cultural origin. We're talking about diversity, of race. We're talking about sexual orientation, visible versus invisible disability. I mean, there's so many forms of diversity, and I don't think those are really captured when we, talk about Canada as a diverse country. And certainly, and I think, why is this the right time? While this has always been a problem, I think it's come to a highlight now because of world events. We've had the Black Lives Matter movement. We've had the rise of East Asian racism. We've noticed a number of inequalities that exist because of the COVID-19 pandemic, and who has been most affected and who has been most likely to either be sick or die as a result of it. And I think it's really highlighted the inequities that exist in our society, and certainly in Canada, everything that has been discovered around the Indigenous school experience, which Indigenous communities knew, but I think now Canada at large is aware of, has really highlighted and acknowledged the importance of equity, diversity, and inclusion. And medicine is a part of society. It's no exception. And we need to acknowledge it, and we need to address it as well.
Wow.
Great, thank you.
Yeah, those are a lot of really important, heavy topics, Nupura. It's almost hard to know where to start. And, you finished off by saying medicine is part of society, but I would say almost that a physician's role in being educated with regards to EDI is of utmost importance because of exactly what role we play in society, right? The relationship Absolutely. We have with our patients and
Absolutely.
and the role that we have in the community as leaders and as caregivers. As you know, I'm also part of the board of directors at the COS, and I don't even know how this came about. How did the COS decide to establish an EDI working group? Do you know the story behind that? Are you behind this story, Nupura?
Yeah, yes, essentially. We started, Nina Huja, who's, a leader in EDI, and with Akupo and I had met many times, and Akupo had started a series of EDI related meetings. Sorry, and Akupo is the Association of Canadian University Professors of Ophthalmology, so the academic leaders of ophthalmology across the country. And they had convened a series of EDI meetings, and I had already been in the role at the University of Toronto, which is also a role that I had advocated for and got the support of our departmental leadership. And I realized as I was doing this work with Akupo and as well as in my local department that no other department had anyone as a EDI director or an EDI lead, and there really wasn't anything happening on a national scale. And I knew that this is something that really needed to be done across the country. And I think, anyone who is perhaps, let's say underrepresented in some way or lacks privilege in some way as a career in medicine, whether it's because you're racialized, because you're a woman, I think we have all had experiences where perhaps we have seen that things are really not, equitable. And that has really driven our desires to change things moving forward. And hearing so many experiences from my own learners in our own program really made me realize that, that perhaps the needle has moved, but really, maybe we have more women in medicine, for example, but are those women treated equitably? Is there a leaky tap phenomenon? Do women move into positions of leadership? So these are all thoughts that had percolated in my mind for a long time. But as I really spoke to Nina and did my work at U of T, I realized that this is really a national problem and something that I have agency. I mean, we all have agency. It wasn't just something that I could sit back and say, yes, this is a problem. I thought, I have agency and I can do something about this. And so that's when I reached out to the COS and had a meeting with Liz and who's the executive director, and Cheryl and a couple of other people who are on the board at the COS, and said, this is my vision for EDI in Canada and ophthalmology. And these are the things that I think we can do. And I think it would be really helpful to have a working group at the COS. And so Liz took that forward to the board, and everybody, as far as I understand, was really in support of it. And so then I was really honored to be asked to serve as chair.
That's really amazing, Nupura. Thanks for your initiative and for bringing this forward. I think it's such an important topic. So now that it exists, this working group, what does the group hope to accomplish through your work you're going to do with the COS and nationally for ophthalmologists?
I think there is so much that we want to do there. That's almost, I think our initial decision was, what do we try and tackle first? Because there's so much that can be done. We really, really want the COS to lead the way. We really want EDI to be considered in every decision that the COS makes, and really to enhance the environment of equity and inclusion and diversity, not just for Canadian ophthalmologists, but really for ophthalmology at large. And so we really, when we met, we've had a few meetings now, and we broke up our initial priorities into a few different domains. We think that there's really a key role for education, for awareness, even just getting baseline metrics and demographics. We actually don't know what exactly the scope of our diversity is right now in ophthalmology in Canada. And also advocacy and support, and long-term trying to increase the diversity of ophthalmologists. So we have kind of picked those as our initial domains in which we want to have objectives, and we have several. If you want me to get into more specific details, because we have a lot of things on the go.
I think what I would love to hear is, with so many different facets and so many different layers to the EDI topic, I would say, is how would you measure success in the short term and in the long term? How you mentioned a little bit about metrics, and so obviously long-term metrics take time, but what would be just some of your short-term successes in the ideal situation, and then the long-term ones?
So I think the short-term ones will be simple things. For example, having land acknowledgements at our annual meeting, at virtual sessions. Just simply the fact that we have one is going to be, I think, an outcome that's successful. Also, having educational sessions that with hopefully positive feedback. I think the feedback from those sessions will also be another outcome measure because we have to see how the things that we want to communicate resonate with our membership. Do they feel that this is something that really does help them? Does it help them provide culturally sensitive care to their patients? Does it help them, interact with their colleagues in a more equitable way? And those are kind of the short-term things we're looking at. Also, long-term, I think the big goals would be to increase diversity of ophthalmologists in Canada, specifically from groups that we know are underrepresented, such as those of Indigenous and Black backgrounds. And of course, really long-term would be not just increasing the diversity, but really increasing inclusion, because we could have them in ophthalmology, but how are they treated? How are they welcomed? How do they thrive once they're ophthalmologists, and really having equity of opportunity? We really need to first find out what the exact scope of our current, essentially our current ophthalmologists of the COS and outside of the COS, what are the demographics? And we don't even have that data.
No. Okay. No, you've defined some very good, clear initial goals and then long-term ones as well. Thank you, Nupura.
I think in the context of understanding that we would all agree probably that inclusion and equity is so important in general in society, but how can you tell us a little bit about how that helps not just ourselves and our communities, but our patients in our care for patients?
Absolutely. So there are many studies looking at the fact that diversity of care providers results in better medicine. Diversity in medicine results in better medicine because we can understand our patients better. We can understand where they're coming from. We can understand the structural context in which they live, which has certainly health impact and affects their health outcomes. And it also improves our professional working environment because diversity of physicians means diversity of ideas, diversity of scientists means diversity of research. And these are known to improve outcomes ultimately.
So in that journey, Nupura, to having a more diverse complement, let's focus, let's say, on ophthalmologists. Mm-hmm. And I know this is something that you've been working on. How do you, when you're selecting candidates for residency positions, then how do you rank them? Do you rank them first on diversity, on merit? How do you distinguish? If you end up with one particular population, is that okay? As long as you follow proper guidelines in terms of EDI. How do you navigate that?
This is not an easy problem. I mean, yes, I think we need to really think outside the box to be able to solve this problem. But this is not an easy answer because you don't want to, it's not about penalizing people who have, done the traditional route of doing research and electives and having a high MCAT score, or all of those other things. But you really want to create equity of opportunity. You want people who perhaps are coming from backgrounds which are less advantaged to be able to have a fair shake at the chance to be able to become a resident or a medical student, whatever level that we're looking at. And really, I think what we are talking about here is redefining merit. And what do we consider merit in medicine to be? And our traditional metrics have to do with their research, their electives, their letters of reference, and then their opportunities for electives. And once they come in and have an interview, there's often a discussion about fit and, quote unquote fit. And we know that this term fit is really so mired in unconscious bias. And, our current system is designed to obtain a certain kind of candidate. And as long as our rubric is designed that way, we will continue to obtain that kind of candidate. And we really have to look at this from the ground up. And there is research going on in this, and there are programs that are trying to address this. Some programs go as far as to say we have a separate stream. If you are underrepresented in medicine, there's a separate application stream altogether. This is not yet in ophthalmology. This is outside of ophthalmology. Other programs are looking at redefining the rubric to have the aspect of life experience and lived experience included, because the thought is that patients may be able to better relate to physicians who have a diversity of lived experience. And there's certainly a thought that leads to structural competency in physicians, and that leads to better healthcare. And so perhaps we really need to redefine our rubric. I'm sitting this year on our admissions committee at the University of Toronto for ophthalmology residency, and that's something that we're certainly going to look at because otherwise we really won't be able to improve our diversity.
And the way you present it is really interesting because you're really, we're kind of thinking at the front end, but really, if we keep the patient in mind, you're really making changes at the beginning that will impact down the line how we treat, how we provide care, how we make our patients more comfortable. So that's very interesting. I hadn't really thought about it that way. So that's very good. And then
I think we also have to think a little bit even ahead of somebody getting to the point of applying for residency, because by that point, so many decisions have been made. Perhaps there are people who would be excellent ophthalmologists who do not think they would ever get into ophthalmology. So, we need to look at medical students in their first few years. Perhaps we need to look at undergrad students. Maybe we need to look at high school students. How far back do we really need to go? Because where are those decisions being made where maybe somebody thinks, I'll never get into ophthalmology because I don't have time to do these unpaid research jobs in the summer. I have to earn my tuition. Yeah. Where are those? I don't have a family member who's a well-known doctor who can help support me, or get me an elective with Dr. So-and-so. Where, perhaps we are losing amazing doctors along the way or amazing ophthalmologists along the way because they think that they're not going to be able to get in, or that their life does not permit them to get in.
Yeah, good point.
EyeCan wants to know what you think. Please send your comments on today's episode or any suggestions you may have for topics or features to communications@cos-sco.ca, and we'll try to incorporate them into future episodes.
Hi, my name is Dr. Nita Ahuja. I'm an ophthalmologist and author of Stress in Medicine, Lessons Learned Through My Years as a Surgeon from Med School to Residency and Beyond. I listen to the EyeCan podcast and think it is a wonderful resource. I'm so happy that this is available to us, and I hope you enjoy listening as well.
Nupura, listen, this is such an important topic, and speaking to you for the past 20 minutes makes me really happy that you're here, and I'm really proud to have you run this working group, and I really wish you so much. And if you need support, and who else is on the working group? Like, my question actually was, do you have resident representatives? Do you have people helping you? What does your committee look like? What are you guys planning?
I have an amazing committee, and I'm really fortunate. I get to be here as the voice of the committee, but the work it really is a working group and a meeting of minds. We really try to have diversity on our working group. It would be kind of sad if our EDI working group was the one that lacked diversity. So we really have representation from across the country. We have gender balance. We've tried to have balance in terms of, racial and cultural origin. And we tried to have someone who's a representative from the Black community as well as from the Indigenous community. And we do have a trainee representative also. So we really tried to cover all the grounds possible with the diversity of our community, and everyone really brings great ideas and great perspectives. So I'm really lucky to have all of them to work with.
One other question as well for you, Nupura, is beyond the doctors themselves, ourselves, how does it translate, or does it have any impact in the staffing of our offices, our hospitals? Are you looking at that too? Or how do you think this will impact our selection of people that work at our offices as well?
Do you mean in terms of
the staff, our staff, our employees, our technicians, that type of thing?
That isn't something that we've specifically looked at. We primarily are focusing on the ophthalmologists themselves and the professional working environment of ophthalmologists, but certainly that is an important area to look at. I think we should add that as one of our future goals to explore as well.
Nupura, what other new projects is the EDI committee looking at implementing in the near future, just to get the ball rolling with regards to some of the changes we're hoping to make?
Well, one of the things that I'm really excited about is that we are planning to have a mentorship program for students from backgrounds that are underrepresented in medicine. So we hope to do this in conjunction with another ophthalmology student interest group that is already established, but really also hopefully reach the students that don't know yet that they are interested in medicine. And so hopefully this will allow these students to see ophthalmology as a potential career pathway for them. Of course, we'll only know if it's successful in a few years when we actually see diversity in ophthalmology, but I think it's an important first step.
So do you have a message for our listeners with respect to EDI and our annual meeting coming up?
Yes, absolutely. The COS is so invested in really moving EDI forward and really moving the dial forward. And so we are having an EDI symposium at the next annual meeting. We are going to have a keynote, Dr. Marsha Anderson, who is a visionary leader in Indigenous health. We even have an EDI abstract stream this year, and we've had several submissions. So it's going to be a really exciting session, and I hope to see all of the COS members there.
Nupura, before we let you go, tell us a little bit about what you do outside of all these other things that you do. What are some of your hobbies, and what have you learned in the past 2 years during the pandemic that you may not have learned had we just kept running on our hamster wheels?
Well, I think it has given us all a time for pause. And really the silver linings, I think, of the pandemic have been realizing more the importance of slowing down, the importance of spending time with family. And for me personally, I think I rediscovered a few hobbies that I had let go during my, track towards ophthalmology and a career in medicine. And I began to paint again and draw again. And I hadn't done that since I was in high school, really. And so that's been really lovely. I took up watercolor painting, and I've done several classes, and I try to keep doing it regularly, even though things have picked up a little bit. Like many people across the world, I took up sourdough bread baking. I have always been an avid baker, but I did the sourdough thing, although I have to say my starter it hasn't been fed in a while and is sitting in the corner of the fridge somewhere at present. And aside from that, really, I love to spend time with I have a 6-year-old daughter, spend time with my family. We, try to take a lot of walks, enjoy weather outside. I think also because so many of us are not traveling right now, we have rediscovered the area in which we live again, and really the beauty of Canada and the beauty of Ontario and the areas around Toronto. So that's been really lovely as well. And I also love to read. So I've been able to do ongoing through the pandemic as well. Those are the majority of my hobbies.
That's a great message to wrap it up, Nupura. And with that, and on behalf of the EyeCan podcast, we would like to thank you and thank Dr. Nupura Bakshi for joining us tonight, as we look forward to bringing you more episodes on very interesting and diverse topics. Thank you so much, Nupura.
Thank you so much for the opportunity. It was a pleasure to speak with the both of you.
Thank you to our guest, Dr. Nupura Bakshi, for joining us. Here's what's coming up on our next episode. We'll be speaking with Canadian Ophthalmological Society President, Dr. Colin Mann, about what's in store for the organization in 2022.
But the obvious elephant in the room is, the trajectory of the last 18 months. I think probably just expecting the unexpected. Maybe, in fact, the greatest challenges are still to come in the next 6 months. Who knows?
EyeCan wants to know what you think. Please send your comments on today's episode or any suggestions you may have for topics or features to communications@cos-sco.ca, and we'll try to incorporate them into future episodes.
The EyeCan podcast has been made possible by support from MD Financial Management and Scotiabank, proud financial partners of the Canadian Ophthalmological Society and Canada's ophthalmologists.
Thank you to the Canadian Ophthalmological Society.
The EyeCan podcast is written and directed by Eric Johnson and produced by John Allaire from Allaire Strategic Works.